So guys, we are talking about gram-positive rods and we discussed Corynebacterium diphtheria in last video. And now let's continue gram-positive bacilli or gram-positive rods discussion with the next organism, which is bacillus. Now there is Bacillus anthracis and Bacillus cereus. So let's start our discussion with Bacillus anthracis. So as I mentioned, Bacillus anthracis is a gram-positive organism. So one important thing about Bacillus anthrax is it causes this is anthrax, and it is spore-bearing bacteria. So it releases spores. So why are these spores important? Because it's a question that has been asked before. Spores of Bacillus anthracis can be used as bioterrorism agents, and it comes under category A. So it's dangerous bioweapon, Bacillus anthracis spores. And coming through Bacillus anthracis, it causes pulmonary anthrax and cutaneous anthrax. We will discuss about those diseases, but how does Bacillus anthracis act is it has an exotoxin, and this exotoxin has three factors, E, P and L. E is for edema factor and P is protective factor, and L is the most important one and the dangerous one, which is lethal factor. So how does this lethal factor act? It inhibits MAP kinase enzyme, which causes macrophage apoptosis, and this macrophage apoptosis in turn increases of the CAMP, which in turn causes edema and necrosis. So that's why Bacillus anthracis is a dangerous disease, and this is how that exotoxin of Bacillus anthracis works. And it has a capsule. It's a capsulated organism, and the capsule is made up of polypeptide, which is poly-D-glutamate capsule. Okay, and coming to the appearance of anthrax, it has bamboo stick appearance, which is very important because it will be very easy for you, like bamboo stick. So it has a bamboo stick appearance, and it has medusa head colonies. Medusa head shaped colonies are just shape of colonies. Medusa head colonies are shape of colonies on normal agar, and it has inverted fir tree appearance. It has inverted fir tree appearance on gelatin stab, and it has string of pearl appearance on penicillin agar. So try to remember all of these points. It has bamboo stick appearance, it has medusa head appearance, it has inverted fir tree appearance, and string of pearl appearance. So if any of these terms are given in the exam, your first thing that you need to go towards is if there is Bacillus anthracis in the choices. Now let's talk about the diseases it causes. Let's start our discussion with pulmonary anthrax. Now pulmonary anthrax is also called as wool sorter disease. So it basically occurs in patients who are sorting wool or works in the farm of sheep and like shepherds, to be precise. So how does this pulmonary anthrax happens is they inhale the spores, which are from contaminated animals or animal products, and it results in symptoms which are fever, chills, and you can see shortness of breath, and this shortness of breath is for 3 to 4 days. And this rapidly progresses to pulmonary hemorrhage and mediastinitis and shock. So this is what about wool sorter disease. We have fever, chills, shortness of breath for initial, and then it progresses to pulmonary hemorrhage and mediastinitis and shock. And another important thing about anthrax I wanted to mention was McFadden reaction. It's nothing but a capsular reaction. It's like amorphous purple material surrounding blue bacilli. So when methylene blue is applied, we see this reaction, McFadden reaction. And talking about wool sorter disease, there is a process known as duckering. Duckering is treating the wool with formaldehyde. Now what formaldehyde does is it kills spores of anthrax. So it's very useful, and it's an important point to remember that what's the agent that's used in duckering is formaldehyde. Okay, talking about cutaneous anthrax. Cutaneous anthrax is like something like this, and around wound a black eschar is formed. Black eschar ulcer, which is painless and necrotic. It is very unusual or very uncommon. It results in basidremia and death. So it's not something to worry so much about. So that's about two diseases it causes. It causes pulmonary anthrax and cutaneous anthrax. Coming to the treatment of, the best to diagnose this is polychrome methylene blue stain. And for the treatment of bacillus anthrax, the treatment is ciprofloxacin and doxycycline. So let's try to summarize it up. Everything is in one paper. It's short and all the important points are covered here. For the bacillus anthracis, and as I mentioned, bacillus anthracis and bacillus cereus are there, and we are talking about anthrax. Anthrax is spore-forming bacteria, and then we have it forms spores, and these spores are used as bioterrorism agents, which come under category A. And the exotoxin has three factors: E, P, L is for edema, P is for protective, L is for lethal, and the lethal inhibits MAP kinase, which in turn causes edema and necrosis. That's how the toxin works, and this causes two diseases: pulmonary anthrax and cutaneous anthrax. And for the pulmonary anthrax, we discuss as fever, chills, which can lead to complications of pulmonary hemorrhage, mediastinitis, and shock. And for the cutaneous anthrax, we see black eschar ulcer. And for the appearance, it has bamboo stick appearance, medusa head colonies, and invertebrate appearance, string of pearl appearance, on penicillin agar. And the best dye is polychrome methylene blue staining, and this McFadden reaction for the capsule. So basically these are the most important points of bacillus anthrax. Let's continue our discussion on bacillus cereus. So let's continue our discussion on bacillus. We talked about bacillus anthracis. Now we talk about bacillus cereus. So talking about bacillus cereus, there is emetic type and there is diarrheal type bacillus cereus. Coming to the emetic type, the incubation period is 1 to 5 hours, and usually what happens is when there is, after the patient eats reheated rice, he has emesis or vomiting, and usually this rice could be fried rice or Chinese fried rice. So if patient had this food item and then after 1 to 5 hours he had symptoms of emesis and vomitings, then you need to know it's emetic type of bacillus cereus. And for the emetic type of bacillus cereus is heat stable toxin. Try to remember China is heat stable, and how it works through cGMP. And also remember E. coli heat stable toxin also works through cGMP. So just remember GDP is stable. So GMP is stable. So if GMP comes here, then CAMP comes here. If it's stable, then it's liable. And for the diarrheal type of Bacillus cereus, the incubation period is 8 to 16 hours. And it's because of contaminated meat and milk products. And this is an heat liable toxin. And the most important thing what happens is after consumption of this meat and milk, what patient has in 8 to 60 hours is watery diarrhea, which is non-bloody. Telling non-bloody because bloody diarrhea is a different. So non-bloody watery diarrhea, because bloody diarrhea comes very differently. It's caused by different diseases like shigellosis and stuff. Yeah, so that's about Bacillus cereus. And for the management or treatment, we give supportive care with antibiotics. And for the diarrhea, as I mentioned here, for the heat stable toxin is CGMP. For the heat liable toxin, it works through CAMP. So basically that's about Bacillus organisms, which is Bacillus anthracis and Bacillus cereus. And next we talk about Clostridium in this video. So let's continue our discussion on next gram-positive bacilli, which is Clostridium. So talking about Clostridium, there are two major organisms, which are Clostridium tetani and Clostridium perfringens or Clostridium welchi. So before we discuss about them, let's discuss about Clostridium first. So these are obligate anaerobes. So these are not facultative anaerobes, these are obligate anaerobes. So they need no oxygen environment. And then these are non-capsulated organisms with slight motility. But for this, there is an exception, because Clostridium perfringens is capsulated and non-motile. So this is very important. If you have a case of Clostridium species and you see the organism is capsulated and non-motile, you should not think all Clostridium species are motile organisms, because perfringens is a non-motile bacteria. So coming to Clostridium, there are also spore-forming bacteria. So can you remember other gram-positive bacilli that form spores? Yes, Bacillus anthracis, we just discussed in this video. Yes. So for the spores, there is drumstick appearance like spores for tetanus, and there is central appearance of spore. So the spore is in the center, so it is perfringens. So if it is like drumstick appearance of spore, then it's tetanus, and if you see central spore, then it's perfringens. So method of anaerobiosis is gas pack, or we create biological anaerobic environment by putting aerobic bacteria, so they utilize all the oxygen and we have the anaerobic environment. So those are methods of creating anaerobic environment or anaerobiosis. Coming to the differentiation of Clostridium, we use a media called Robertson cooked media. This is very important to know, Robertson cooked media, because on Robertson cooked media, if it's turning pink, then we name it saccharolytic. And most of the Clostridium bacteria are saccharolytic. Now there's Robertson cooked media which turns to black. Now if it's turned to black, then it's proteolytic. And what's a proteolytic organism? It's tetanus. So only Clostridium tetanus turns Robertson cooked media to black and it's proteolytic. So you need to know this because the organism is tetanus. Coming to, let's discuss about Clostridium perfringens first. What I want you to do now before we discuss Clostridium perfringens is I want you to open Google and search for images on gas gangrene. because this is a very high yield image that has come in various examinations, and so that you would know the image and you would know the organism that's causing it. Okay, let's continue the discussion. For coming to the Clostridium perfringens, it has type A to type E toxins, and the most important one is A alpha toxin, because it produces lecithinase and phospholipase. Lecithinase and phospholipase, which causes myonecrosis, which in turn causes gas gangrene. So if there's a question how Clostridium perfringens cause gas gangrene through which toxin, is alpha toxin, and alpha toxin produces the enzyme lecithinase. Yep. Now another important points on Clostridium perfringens is food poisoning. So what happens with food poisoning is the onset or incubation is 8 to 24 hours, and it's caused because of heat liable enterotoxin. So if there's a question saying a person had food which is contaminated and then he had food poisoning after, let's say, 12 hours or 13 hours, and what toxin is responsible for it, and the organism is Clostridium perfringens, then you need to know it's heat liable enterotoxin, and it's mostly because of contaminated food, like contaminated meat mostly. And there is another important point, that is necrotizing enteritis, which is also pig bell. Now what is this is when you ingest pork with sweet potato, it causes uncooked pork. This is it causes necrotizing enteritis, which is pig bell, and you need to know it because beta toxin is causing it. Another important point on Clostridium perfringens is a stormy fermentation of litmus milk, and also Nagler's reaction and target hemolysis. So if you see hemolysis, target hemolysis on slide, and there are symptoms that points towards Clostridium perfringens, then you need to know that this is the organism without thinking much about it. Yes. And the other important point is it shows bow tie hemolysis. So if there is this hemolysis, so it shows something like this. So it's bow tie hemolysis. And reverse camp test. So we have discussed all the important points on Clostridium perfringens. So just to summarize, it causes food poisoning. The main important thing, it causes crepitus, which leads to gas gangrene, and the toxin responsible for it is alpha toxin, and the enzyme is lecithinase. And the food poisoning is because of congested meat ingestion. It can also cause pig bell with sweet potato, and the beta toxin and uncooked pork can be cause of pig bell. And then it caused stormy fermentation of litmus milk, Nagler's reaction, target hemolysis, and then bow tie hemolysis, and reverse camp test, and double zone hemolysis can be seen. So these are the main things. If you remember these stuff, these are the keywords, or high yield stuff that you see in questions regarding Clostridium perfringens. And also you need to know that sometimes during emergency of Clostridium perfringens, we use hyperbaric oxygen as treatment. So you need to know that, because why hyperbaric oxygen? Can they survive aerobic environment? No. So simple. Yes. Let's go towards our next organism, which is Clostridium tetani. Now we have discussed about Clostridium perfringens. Now let's discuss about Clostridium tetani. Before we discuss about Clostridium tetani, I wanted to mention that both tetanus toxin and botulinum toxin cleave snare protein in neurotransmission. If you know the neurotransmission during synapse, there is pre-ACH, here these proteins are called snare proteins, and these toxins help by cleaving these. So you need to remember this, because sometimes action can be asked of how these toxins work or where they work, and they can point the snare protein, and you need to know, yes, this is the place where these toxins act. I just wanted to mention that before we start discussing Clostridium tetani. And for the Clostridium tetani, or it causes a disease, tetanus. Many of you know this, tetanus. And tetanus is also 8th day disease. And incubation period is 8 to 10 days. And for the tetanospasmin, Clostridium tetani produces tetanospasmin, which acts how? It causes presynaptic inhibition of GABA. Constant excitation will be caused because GABA is inhibited now. What happens is there is constant excitation, which causes lockjaw and opisthotonous position. Now, please Google the image of opisthotonous position and lockjaw, so you'll know how tetanus patient looks like. And I also want to mention that those who are appearing for Indian exams, India is free of neonatal tetanus. So we got free status of neonatal tetanus. We don't have neonatal tetanus anymore in India. So as I said, tetanus causes spastic paralysis, which is trismus or lockjaw, and then sardonicus, raised eyebrow, and open groin. So you need to know, when you see these images or these kind of symptoms in the question, if there is trismus, if there is lockjaw, if there is opisthotonous position, or if there is sardonicus position, or images related to it, then you need to know you are talking about tetanus. And how can we prevent tetanus is, we can give tetanus vaccine, and there is antitoxin, antibiotics, and diazepam. Because there is overexcitation, we give diazepam. And wound debridement. Why wound debridement? Because we know tetanus can spread through a wound. If someone is wounded or had an injury, there's a high chance he can have this tetanus infection. So that's why we need to do wound debridement. It's about two important organisms of Clostridium, Clostridium tetanus and Clostridium tetanus and Clostridium perfringens. So let's now discuss about the third organism, which is Clostridium botulinum. Now this is another very, very important topic, or because many questions will be asked of botulism, and so that's why you need to know this. So what botulinum does is it produces heat liable toxin, which inhibits ACH release. Now what inhibits GABA release? Is tetanus. And what inhibits ACH release is Clostridium botulinum. Okay, so ACH release is inhibited at neuromuscular junction, and you know what neuromuscular junction is, the synapse. So the main question they keep asking about botulism is, let's say there's an infant and he had honey or some canned food, and then he's having now floppy baby syndrome, which is flaccid paralysis kind of symptoms. So what is your diagnosis? Then you need to know straight away is botulism. You don't need to even think that. But nowadays questions are not this straightforward. They will ask you what's the mechanism of the toxin of this disease. Then you need to know it inhibits ACH release. So that's how it's working now. And okay, let's talk about 5 Ds of botulinum. 5 Ds of botulism, they are diplopia, which is double vision, and dysarthria, dysphagia, dyspnea, and descending flaccid paralysis. So 5Ds of botulism. If you see a patient with diplopia, dysarthria, dysphagia, dyspnea, descending flaccid paralysis, you need to know that it is botulism. Now botulism is from canned food, as I mentioned, so always remember, if there is something related to canned food in the question, try to always think towards Clostridium botulinum. And if there is honey, or infant had honey, or someone had canned food and all this stuff. So for the treatment, human botulinum immunoglobulin is available, and local botulinum toxin, Botox injections to treat focal dystonia and hyperhidrosis. Now for the botulism, I talked about treatment. I'm talking about Botox injection. The toxin that is made up from botulinum is used for what? This is what I'm mentioning here. Don't take me wrong as if Botox is used for botulinum. No, please. Botox is a potent toxin on earth, because many use it for, Botox can be used for, eye surgeries. We use Botox, and then for blepharospasm in ophthalmology and strabismus, we can use it there. And as I mentioned, for hyperhidrosis and for focal dystonia, and if you see muscle spasm. And the most important one, Botox, is nowadays used for cosmetic purposes, is to reduce wrinkles on face. So yes, that's basically about Clostridium botulinum. And I mentioned about Clostridium tetani, and I mentioned about Clostridium perfringens. Now let's discuss about another Clostridioides difficile. Now don't be confused that difficile comes under, or difficile or difficile, it comes under Clostridium. No, Clostridium has tetani, Clostridium tetani, and there is perfringens or Welchi, and there is Clostridium botulinum. So we have discussed about these organisms. Now I wanted to discuss about Clostridioides difficile or difficile. So for the Clostridium difficile, we have why is it so important is because it causes antibiotic usage diarrhea. So if someone is taking antibiotics and has diarrhea, the first thing we need to consider about the organism, that's Clostridium difficile. And what antibiotics are most risky are clindamycin, quinolones, and penicillins. And it produces toxins, which are toxin A and toxin B. Now what these toxins does are, it damages enterocytes. It damages enterocytes, leading to the most important term for discussing Clostridium difficile is pseudomembrane colitis. Whenever you see pseudomembrane colitis, the image is very important. It would be something like an endoscope, and then the damage would be seen as something like this, or white patches in the white patches will be seen. So you need to know that this could be pseudomembrane colitis, because especially after patient presents with usage of clindamycin or quinolones or ampicillins, cephalosporins, and sometimes also with PPEIs usage. So yes, and they could be causing toxic megacolon sometimes, and toxic ileus, and shock. If there is a fulminant infection, it can cause toxic megacolon and shock. So as I mentioned, difficile causes diarrhea after antibiotic usage. So what's the drug of choice or the treatment for Clostridium difficile is vancomycin. So the diagnosis can be made by PCR or antigen detection, or both toxins will be in stool. So that's all guys. In this video I have discussed some more organisms continuing of the gram-positive rods or gram-positive bacilli. So let's continue in next video about the remaining gram-positive organisms. Thank you for watching.